are at DHN podcast. Today's we want to discuss a very interesting topic, building smarter lab using LIMS automation, the role of LIMS automation and data-driven diagnostics. I have with me Niraj Desai also. I know Niraj from more than a decade, but I'll ask Niraj to give his intro. Niraj, hi, how are you?
Yeah, hi. I'm good. Thank you, Amit, for the for the opportunity. And so just to give you a brief about me, I have been with CrelioHealth for almost 10 years now. Uh, we started it's a 12-year-old organization. We started it as a SaaS platform for labs. And when we started, we were actually selling softwares at less than 1,000 rupees a month, and the cost for internet was more than what the software cost. And we have come a long way since then. And we have grown to 33 countries now. We have presence in US, UK, Middle East. And also we have seen that the landscape of the labs in India as well has changed a lot. And we have loved to be part of the overall journey of the diagnostics industry in the country.
Great. So we both are helping lab companies to scale. You are providing technology, and we are providing tech-enabled supply chain network across like pan India, where lab can use your technology and my network to scale the operations. So Niraj, we know each other from more than a decade. We have been talking on and off, right? So I think today's topic is very interesting. We all have been part of this journey and we all have been user and provider of LIMS. I want to discuss with you how LIMS is helping lab companies, what has been your journey, what you have seen LIMS going through, change, and how it is helping lab to automate. When we say automate, what does it mean in terms of lab? Let's say I'm a lab company. I'm saying
Yeah.
I want to automate my lab. What does lab automation mean in general?
So maybe, yeah, we can start with a basic that, okay, what is lab automation overall? So I think lab automation for different people means differently for how they look at it. For example, for a small lab, just sending the SMS automatically is what would they say as automation. For a bigger chain, it would be the transfer of samples, logistics, and the analytics and the report delivery. So I'm sure that you are one of the veteran in the industry for the logistics, and I think that is where most of the automation for the higher end labs happens these days, because I feel that they have already covered most of the bases that the LIMS or the inside the lab side of it. Because inside the lab, I believe it has been like a long journey, and a lot of people have been working on making sure that whatever is inside the lab is automated. I believe that is where you come now and tell us that, okay, how outside the lab as well automation works. So maybe you can also share a few insights on what outside the lab that you are automating as well. That would help, I believe.
Sure. So what I have seen in my journey in healthcare, I have been working into healthcare more than a decade. I have seen LIMS definition or lab automation definition has been changing over the time. Initially, it used to be just using a software that is able to produce my patient report. That's it. But that burden, that automation definition has changed drastically over last 1 decade. Automation is also increasing. What that means is, as a lab company, I don't need just to produce my patient reports. I also need to do a lot of different things. I also want to automate my other work, which I was doing manually or not as a part of software. For example, other than generating my patient reports, am I also able to generate billing using it? Am I able to touch my patient via communication? Is communication part of my automation or is it still manual? Once I send that report to patient, am I able to take feedback from patient or is it just that business transaction has completed and that's it? I think those parts are also expected to be part of automation. That is after my report is completed. Before that, there's a huge opportunity. For example, most of the patient, they don't want to come to lab. They want somebody to come to home, right? So once booking is done, somebody should go to patient home. Sample should be collected seamlessly with proper information. Phlebotomy should have. Sample should come to lab. It should go to inside lab automatically, and then report should be produced. Patients are also expected that if I'm a loyal customer to a patient, right, all the data should be with lab, and they should be able to provide me much more than just a record of my test. So I believe end-to-end part should be automated. That's my take, and that has been journey. I have seen that LIMS as a software is changing and putting into lab.
Yeah, exactly. I think you rightly pointed out that earlier it was just the reporting side. Now it is more the other things as well. So I think recently we have seen a lot of focus on the pre-analytical phase being one of the prime, because I think the edges is where they are trying to make sure that it is better. That is pre-analytical and post-analytical things. Like you rightly pointed out that on the post-analytical side, people are expecting that patient is expecting better reports. So there are, I think, a lot of smart report companies these days giving insights into patient reports in a better way. And everyone is trying to do that. And on the pre-analytical side as well, a lot of people are trying to make sure that the pre-analytical errors are reduced and better positioning is done in terms of how the patient can visualize the overall journey, including the sample being transported and all of that.
So you implement LIMS software or you do automation for a lot of labs, right? Do you see that lab which says we are digitized? Are they truly digitized? Are they truly automated?
To be honest, I have not seen someone who is like 100% automated or digitized. Okay. Because especially in India, of course, when we because we serve international markets as well, there are few countries or few labs where we see some kind of, at least they have achieved 90% maybe digitization. But in India, still we see, like, for example, on the billing side or the ordering side, a lot of ordering is still happening manually. There are hardly any system which are integrated. Even the biggest lab still does manual order entry. They don't do automation. They don't try to read it from the patient side directly, or they don't integrate very easily. So, of course, these are the points where I feel that, okay, people are not digitized. But of course, inside the lab, the operation part, mostly like 95% of the labs are now digitized on the operation side of it. Whereas like once the machine gets the sample and getting the results back in the LIS, and having the PDF ready. So I think this is something which is like the core which has been solved now. Now it is more about how can the communication be automated. So a lot of people they do implement this automated communication, but it works in a silo. It is not very closely knit with the operations overall. And I believe that is where the opportunity or more digitization is required as we go forward.
I agree with you. I have seen a lot of cases, a lot of companies, in fact, more companies where lab part is automated, analytical part is automated, but outside analytical part, everything is broken. There's a lot of handoff, a lot of manual intervention when we go out of lab in terms of pre-analytical part, in terms of customer communication, in terms of billing part, data intelligence part, data part is totally missing. So all those things, a lot of manual intervention keep happening. So digitization is there, but it's into bits and pieces. One part is digitized, other part is they're trying to do, but both are not talking to each other, then getting data into Excel and trying to do something. I think there's a lot of opportunity to automate or digitize as an end-to-end process.
Definitely. And I believe that the major advantage would be to actually digitize so that the errors can reduce, because there are so many pre-analytical errors that still happens. And if you talk to like 10 labs, 9 of them will say that, okay, that's a problem, but they still don't invest on actually solving that problem.
Like you have implemented a lot more labs. And so how do you see where does LIMS software sits inside the lab? What is the overall ecosystem? What all stakeholders does use LIMS and how do they use it?
Yeah, so now if you ask me these days, like LIMS software has to cover everyone in the lab. So, for example, if you ask me, like our implementation would cover from the registration stuff, the order entry, then the accessioning, where the barcoding, the accessioning team, the operations, of course, as we spoke, that is mostly solved by all the labs now. And then post analytical, where it comes to the doctor approving it, making it easier for the doctor to approve, because there are labs who are doing thousands of samples, so you have to give them options where they can focus on the right things, and so that the patient quality or the reporting quality can be increased, and finally communicating these results back to the patient. Those from the industry, of course, know that okay, for the lab, it is not the patient, but the consumer is actually the doctor and the B2B partners as well, because a lot of labs do get business from B2B. So as a LIMS, we are also supposed to make sure that the order entry from the B2B clients, communicating with the B2B clients, communicating with the referral doctors, all of this has to be part of the LIMS overall. So
Yes.
when we
I
talk,
think
we do all of this. Yeah.
you have actually touched. I think the bigger piece which is still missing, which people don't talk about, is either, let's say, sales part,
Yeah.
billing part, right? Those things are still untouched. I believe that LIMS software needs to expand its reach within that lab ecosystem, not just lab ecosystem, lab company. All different departments, they should be able to take data, put data back into system as a different stakeholders. LIMS should not be just automation for operations or just for like a analytical part.
Definitely.
Sales, marketing should also come into that. Once sales, marketing, and all the team, all different departments become part of that one common system, one common automation system, all start talking to each other. I think then a lab company will be able to grow much, much faster.
Definitely. I think that's rightly pointed out.
One is sales, one is marketing. What all other parts do you see that where we see link system or lab systems are broken?
So I believe like one of those is I believe on the collection side, specifically because what has happened is that earlier, like every patient was expected to walk into the lab to give the sample. That has changed now. Now, if the patient is in the hospital, you need to be there to collect that from hospital. If patient is at home, you need to do the home collection. Wherever the patient is, you need to be collecting the samples from there. Okay. Also, so that is where I believe that not. So there are a lot of systems which are actually present, which can help, but not a lot of labs are actually investing on actually. The phlebotomy
Right.
solution or those kind of automation where you can give patient a better like experience.
Before
And
sample reaches to lab,
yes,
there
yeah,
is that in general no visibility. Lab keep waiting for the people when will sample will come and they start processing and then all sample comes after 2 p.m., 3 p.m. Let's say. I think those visibility, if they come into system, it will help labs a lot in terms of productivity, which is currently broken.
yes, and it is also that it comes in late and it is all like with photos. It is all manually written TRFs. They get
Yes,
photos, they're sent on WhatsApp. That's it. So there is no
yes.
visibility that they are getting in terms of okay,
And
how
most of
much.
the work happens over WhatsApp. This is a
Yes.
photo, right?
Yeah.
And when scale increases, then chaos happens.
That's I think one of the things that we keep on hearing from labs where we talk to them that okay, what are the problems that they are seeing? How can we help? This is a
Right.
common thing that we see. Yeah.
I have seen so many different labs. Their way of working before automating, before implementing LIMS is different. After implementing LIMS is different. What you have seen, what does change? How reaction comes? How does overall culture changes when a small thing, let's say LIMS, start automating the overall journey.
So with like recently, if you see, I have hardly seen any lab who are completely off the record, like they are not using any system. You will hardly find such labs now. So mostly
Right.
they would be using some or the other system, and that is where, so even when we are actually implementing, it is about actually the biggest issue that we face is about like this is how I'm doing right now, and this is how exactly I want to do now again. So a lot of time we waste time in terms of explaining that if you are going to do the same thing, you are going to land up in the same issues again. So there has to be a system. So you are implementing this so that you can solve your issues, right? So
Right.
yeah, so that is one of the things that we quite see, and yeah, like earlier we used to actually resist this change a lot. That okay, why do you have to actually change the name in the software and all of that? But as we have grown, we have made sure that okay, customer is the king. If they want to call the approved report as like signed report, you have to call it signed report, because that
I
is
think
what
I have
that
seen
is.
this phenomena. I have seen this phenomena where, and it is not just into healthcare, it is in general. When we implement, let's say when we start automating, when a company goes in automation journey, rather than changing their style of working towards how software is solving a problem, they want software to work as per they have been working.
Yeah.
If software will get mold the way I have been working before, that will not give me any solution further. I need to change my way of working, my way of thought process, and align it with that software automation so that I get better with the automation part. That challenge I see. And when I see this challenge, that everything is getting changed as the way I want it to work in my way, the way I have been working manually, I started seeing challenges, and those are like red flags that it may not work for long term.
Yeah, I
That I have
agree.
seen. Oh, huh.
Yeah, and I think the only way for that to be solved is when the management themselves are involved in the implementation. If
Right.
they are like having a very bird's eye view, then the implementation definitely is not going to be very successful, or whatever they had planned to achieve out of the implementation of automations and all, that might not be achieved, because you will see that they would still, for example, the doctor would still be actually going ahead and checking each report and doing the calculation themselves before approving. Whereas there are systems where it can be done very easily now, and that has to be all automated. And like the critical, for example, or reruns can be automated, but that will never be implemented because of the like the issue at the user side.
And I have seen once implementation has gone right, everything has gone right. The first thing which impacts is the productivity of that lab. So rather than chasing everyday work where the sample have report gone out or not, and that's the overall work in the lab, then people start asking question that why this is happening, if there is a delay, how can we improve this? Then suddenly metrics change, questions change. Am I doing the right way? Why there are delay happening? Why this is not happening in a certain way? And how do we improve this? And once a benchmark, once a basic things gets into place, then there is expectation of more and more via the software and implementation.
Yeah, I think giving the right visibility. So once the visibility is there from the software, that is when people start getting into a proactive zone that, okay, now I know, okay, this is the delay, like this is not working. So why is it not working now? Because earlier it would have been that they would get those data only maybe after a month of time, and by then it is hardly the data has become unactionable. So as soon as the visibility is there, I can see that okay, there are a lot of changes that happen in terms of how the reactions are.
And how far we are from fully automating the lab. If we talk about the context in India, I know that outside India there is a different way, and people focus more on like efficiency, productivity rather than putting people in the process. how far, so that journey has also started in India, right? In last 5 to 7 years, that journey has accelerated, and a lot of labs have fully automated. But how far are we from overall ecosystem when we talk about, yes, we see lot of labs or lot of in healthcare diagnostic sector, we see that automation is there. How far we are from that point?
So I believe we are near in terms of what is pending, but the pending part, which is on the because India, like for example, when we talk about international market, for example, if you talk about US, the top two labs there, they control more than 70% of the market there. Whereas in India, it is so fragmented that the top five labs would be having less than 10%, 12% market share. So everyone is having their own system. So this has to talk to each other first. So I think that is the most critical part, which is right now missing. And this is something that I believe will be needed for us to actually move towards complete automation, where
Right.
systems have to talk to each other, because in India there are so many different systems, so many different labs using their own systems. They don't talk to each other, and there are still samples being sent from one lab to another with all
Right.
manual. So
Right.
that has to be solved, I believe.
I think what I have seen, that bigger labs which are working operating at a national level, they have done very good job. They are using technology automation not just as a software part but as an infrastructure layer, and to one layer. They have done fabulous job in last few years, and I would say I will give them very good rating. That job done is fabulous. Regional labs are reaching to that level. They have understood if they have to grow to national level, it can't be just done as a people base. That automation, infrastructure, SOPs have to come into place. Otherwise, they can't reach to that aspiration of national level. Smaller
Definitely.
labs are still struggling. They're still struggling because they have a limited bandwidth and a resource constraint. Those labs are still struggling. But I think that's a journey. Once you come out from basic needs, then you start moving to the next level, and next level. But I see over next 5 years, by 2030, we'll see a lot of acceleration about automation using software. I think India will come to a place where we'll be proud, at least in our domain, that we have seen the complete journey. A lot of companies have done that part. That is my feel.
No, I am also hopeful, to be honest, and like I'm hopeful that this happens, and we see that okay, most of the labs do follow this kind of automation and digitization. My biggest worry, I'm still worried about that most of these smaller labs is the feeder for these big labs, and they have to be taken into the system of automation for us to complete the cycle, is what I believe.
I think that's your and my responsibility
Yeah.
to build better system, better operating system, better software infrastructure to provide to lab companies.
Definitely, we had that vision, and we are following that as well. Yeah.
Right. So which part is harder? Is it selling the limbs or is it implementation of limbs? Because you play a dual role, I believe, Niraj.
Yeah.
You are on the sales side also, and then taking responsibility of the implementation also.
I would say so. Earlier, I was doing sales, and that time I thought that sales is difficult and operations is easier and onboarding is
Right.
easier. But when I actually ended up doing both, I found that actually implementation is the difficult part of the thing,
Right.
because selling, it is you are talking to like the decision maker, or there are less people involved. You don't have to actually influence everyone. Whereas in onboarding, you are selling again, and that is not to one person but to everyone, because
Yes.
everyone has to
Limb
be.
software implementation it's
Yeah,
difficult in itself,
yeah,
right? And when they are proprietary workflow, a lot of customizations, culture changes, culture issues come, culture challenges come,
yeah,
and bringing every stakeholder the same table, same page, that this is the way everybody has to work. They have to agree on this also. I think that's a bigger challenge in implementation.
yeah. And
Everybody
that
wants that.
is
Everybody wants a better life, right?
Yeah.
That my work will be solved by this automation, but everybody has to come to that agreement that that's a way of working now.
And it is also about this that we have to identify for everyone what's in it for me, kind of a thing. So everyone has to, okay, that for certain point of time they need to actually put in additional effort of learning the new thing or
Yes.
changing some things. And for them, it has to be like a win-win solution that, okay, why would I do that? Because they are not being paid for it. We are being paid for it. So that's what I feel that.
What I have seen is that, or what I am thrilled about is that when all this data which lab companies collect, it goes into a software, it gets structured also out there. I see a lot of opportunity for labs itself. But do you see that lab have been able to use that opportunity, their data in their growth, in their productivity, in their scale?
To be honest, I have not seen many labs able to take the data and do the right things with it, especially on the patient side of it. So, where they can actually engage with the patient better and give them more insights. But this is one of the things that I feel in the last couple of years, at least after COVID, one of the things that has changed is this, where a lot of labs are trying to give better reports, better insights to the patient, use their data to the right way. For example, a lot of labs now, we have requests from labs who are trying to so we, for example, have a AI built on our analytics. So a lot of labs, they we see that, okay, they are trying to run queries to see, okay, where is the trend going, which are the patient, like what kind of trend they are seeing on the patient side, how much is the repeat frequency. They are actually now measuring that. Earlier, I hardly saw anyone actually measuring the
Right.
percentage of repeat business. Now, a lot of labs are asking us that, okay, this has to be on the dashboard, that what is my percentage of repeat business. And they want to give the patient the trend report, for example, that how has the patient like vitals change over a period of time. They want to give this to the patient by default. So all of this, we have definitely seen a change, and more labs, I feel, are trying to take use of the data. Earlier, when we actually changed the system for new clients, we would never get a requirement to actually migrate their data. Now it is a must-have. People are expecting to migrate their old data because they expect that, okay, this is my data and that has to be used now. So
Yes,
I
yes.
feel that more and more people are getting educated, and they know that, okay, data is important for them now.
I think every single lab, they must ask their LIMS vendor, what is my repeat rate? What are my chronic patient? If there is a chronic patient, right, he must be going to some other lab. I can touch base with my chronic patient, and this will increase my repeat rate also. There should be a patient feedback mechanism. I should be asking about my service as a lab company, that what is your feedback? And if there is anything not done right, then work on that part to improve that. Build lot of intelligence on and provide the data to patient that you came to me, let's say 10 times in last 2 years. This is your trend, and doctor will love to see that report, right? And there is a ABDM also coming. Labs can connect with ABDM. They can fetch data, provide to patient, provide to doctor also, and they all love to see all these things because it helps a lot. This is their data. Lab companies should demand these things from LIMS companies, that I need these things, and this is going to help lab companies to grow at a much faster pace. That's my
Definitely.
take on this thing. They should do this thing.
Definitely. And Amit, one of the things that I like for us, what helps is that this repeat business, okay, for example, we actually got this from client in Middle East and Philippines, because they actually are doing 40% of their business is repeat business. So when
Right.
we actually gave that insight to labs in India, they loved it, and now everyone is asking for that. Okay, that this has to be there in the software. So I believe
Yes,
that
yes.
more and more, as more and more labs, they see and visit international conferences and all of that, now because everyone knows what is everyone else doing, so there is a lot of pressure, and I think that will get
I
everyone.
always tell my clients, lab part is sorted. We are providing very good reports. Other than lab part, a lot of things needs to be done. Let's not be shy about asking my repeat rate, my customer feedback, where I'm doing wrong. Let's improve that part. Let's touch base patient via different communication. Tell them, show them what we are doing. Those kind of stories, right? Not just as a lab part, that part is already done, but as a lab company there is many other things that we do and we must do other than just giving report to patient is has also seen that okay, I will get this report. What else, right? So as a company, as a healthcare company, I can do lot of innovations over different things over patient data and provide them valuable insights also.
Definitely.
When there are so many different things we're talking about, how does cost come into picture? Because we all have seen, at least in India, that everything is required, but what is the cost? And cost always comes as a challenge from both sides, as a from client also, from lab company also, and from a LIMS vendor also, right? So what is the cost perception? How does cost work from a smaller lab to bigger lab?
I believe that as I told you, like when we started, the cost of internet was more than what we used to sell our software at. Okay, of course, we have been able to increase the cost at our side, like we get better pricing, and the internet has gone down, which is a good thing. But overall, I believe that there is a market where people are okay with paying the right pricing for if the software is or the value add is there. So we have seen that people are not like hesitant, or they are not looking for something free these days, and that has been a change that I definitely see in the market, specifically on regional players. So regional players now, because they say that okay, they have to compete with the national players in terms of their offering, so they are quite okay with spending a good amount to ensure that they are able to give the same level of services with the right IT infrastructure. So that has been our sweet spot. We don't see like we still see that there is a lot of pressure in the smaller segment, because for them, as I told you, they are expecting bare minimums, and
Right.
they are okay with having a bare minimum solution at
I
the
think
minimum.
I have seen a trend of smaller labs because they have a resource constraint and all those things. Definitely, we have gone through the journey on the vendor side also. When we have a smaller structure, right, we want to solve today's problems. If I get something, let's say LIMS as a software, as a layer, what problems it is going to solve for me today? And do I need to spend additional, or will I save some money from somewhere else and that will feed that my automation journey? Bigger labs have a survival problem. They have a problem scale. If at a bigger level, if I don't start automating for today and for tomorrow also, I will definitely not be able to scale further, and the chaos will come into place because that scale has issues that place, right?
Yeah.
So cost perception changes at a scale, it becomes a need. Definitely, cost perception will be there, but I can't ignore, I can't delay that part. I need it today itself. That I have seen playing between smaller companies where they might delay. They say, okay, I will take a decision. It may take 1 month, 2 months, or 6 months. After reaching to a certain level, say, I need it today. I have already made a decision late. I'm making a decision late
Yeah,
after 6 years or 6 months. I need this today. Otherwise, there's going to be a lot of chaos. Right. So
definitely.
this is the play I've seen there.
Yeah, definitely that happens a lot. Yeah, that people
Yeah.
they keep on pushing it till the time the pain becomes unbearable now, basically.
And I have seen bigger labs, they are taking it very seriously because like the future, when we talk about future, it becomes very difficult to see future without complete automation. And automation is not a one day thing, it's a journey. Today I'll do something, tomorrow I'll improve that, and day after that I'll do something more over this, right?
And getting into a proactive zone from a reactive kind of approach in
Right.
automation is what most of the labs are now getting into. with AI and all, which is coming up more and more. Like everyone nowadays, wherever we go and present, they would ask us that, okay, how are you using AI and how can
I think
that be?
it's a very interesting thing. Everybody's talking about AI. Everybody wants to use it, AI. I'm not sure how many people are using, at least in India, right? What's your take when there is a question from you, like what you do in AI, what you can provide to your clients? What's your take?
So, to be honest, like we have implemented two things that we are doing using AI right now. One is a billing agent. So basically, what we are doing is we are actually, as I told you, like most of the orders are still coming manually on a handwritten TRF. So we are trying to. We have a bot which can actually automate that, read the prescription and do the ordering themselves. So that is on the ordering AI, like AI to make sure that the ordering is sorted. So we have already deployed this. There are labs who are using this already. Second is a solution on the analytics side, where we are trying to give insights into their data, because bigger labs have so much data and so many dashboards. So earlier we used to keep on building dashboard, one operation dashboard, finance dashboard, B2B dashboard, marketing dashboard. Then we found out that how will people actually find out, okay, what they have to do? And that is where we actually introduced AI analytics on the top of these dashboards, so that they can get better insights into their data on a single click. And we have seen a lot of labs are using those kind of things right now, on the analytics side. And on the ordering side, we have still not seen as much as an uptake that we are expecting. But on the analytics side, like almost 80% of our labs, they use that.
I think there are a lot of opportunities that will unfold for the usage of AI because healthcare is exhaustive. It is so big thing, right? And lot of things, sub things will evolve under healthcare where AI will be used, at least in diagnostic in our field.
I would like to understand from you as well, that because you are doing things which are on the more on the ops heavy side of it, how, are you doing any, like how are you
Yes.
using AI on your side
So
of the
I
things?
love understanding what I know that I know. I love understanding what I don't know and AI can tell me. What is not working right, that AI can tell me this is not working right. That kind of exceptions visibility, something which I don't know. How will it come into place? Right? For example, we have thousands of people on the field. They all collect sample, they all give to lab. When we started, the journey was manual, right? We and a lot of inefficiency. If my guy is going to 30 40 place in a daytime, how I'm going to make his life easy and better and more efficient? What I have seen is that in some examples, if a guy used to take 6 hours, we had cut that journey to 3 hours or 3.5 hours. We have also started predicting whether my field guys are going to collect or pick samples. Will those samples be there or not? What is the probability out there? If there is a lesser probability, we understand there's a lesser probability and work accordingly.
You can
If there is
prioritize.
a yes, if there is a route disruption, how do I how do I tell my clients or customers that there might be a delay in reaching sample to the lab and hence customer reports might get delay. I love personally understanding those kind of patterns and work on those things which I don't know, which is not in front of me, but that is going to impact my work today and tomorrow and day after. How can I bring those patterns, put into AI and solve those things?
Exciting times, I
Yep,
would say.
yep. I think after 5 years, the way AI is coming and things are changing, I think everything will change after 5 years. It is not going to take another decade. After 3 years, 5 years, things will change. I believe the way labs are operating today, those things will change. They will not
Definitely.
remain same. For example, my gut feel says, let's say we are in 2026 after 4 or 5 years, let's say around 2030, 2031, plus minus few years here and there. Most of labs have reached to tier one and tier two cities. Those part have already been sorted, right? Tier three labs Tier 3 cities, we are already there. Tier 4 and remote towns, there is still a challenge into healthcare access, right? Now, how does lab work? There is a national level lab, then there is a regional level lab and tertiary level lab, right? I believe healthcare will be accessible to tier 3, tier 4, and remote towns. And the reason is currently we are, let's say, around $3.8 trillion GDP. By the end of this decade, India should be around $10 trillion GDP, and 2035, it should be $15 trillion. That when that money is coming, that per capita income is increasing, that has to reach to tier 2, tier 3, and tier 4 and sub-towns, right? When that per capita will increase, healthcare has to reach there. Now, lab sample will not travel to regional levels and national level. They will be decentralized. Lot of decentralization will happen. Smaller labs, smaller pods will be opened at a smaller cities. Technology will change. Analyzer will change. Rather than having a bigger analyzer, which is costly, into national level, it will start reaching to smaller decentralized labs. And all those patient samples will come there into those maybe smaller town, tier 2 towns, and the reports will be given. Number of tests will increase. People will start going to preventive. It has started into tier 1 and tier 2, but I think not beyond that. It will start going to tier 3, tier 4, and sub towns also. Preventive. And as all these things will increase, it will only happen through the complete automation layer. So LIMS will not remain a software, not just a lab part. LIMS will become an infrastructure layer, end-to-end layer. And when we talk about decentralization, it will not happen unless there is a huge, very powerful infrastructure layer that will bind all those tier 1, tier 2, tier 3, all those different departments, all those things. That is my vision when I see what will happen after 5 years. I see this should happen in India, at least.
Yeah. No, I agree. And I think you rightly pointed out that the volumes would increase a lot, because one of the things that we see is the per sample, number of tests per sample average. If we see in India, it is around 2 to 3 on the platform, what we see. Whereas when we see in US or in Middle East, it is around 8 to 10. So there is a huge gap in terms of the growth which can happen. And as you rightly pointed out, that this will need a better system. And I really like the concept of LIMS being the infrastructure and not a software.
It has to become an infrastructure layer. If we just keep treating it as a software which will solve my 5 problems, but not all, I think expectation has already increased, right?
Yeah.
So unless this become an infrastructure, it will not be fully justified. It will not justification with that expectation from our clients out there.
Definitely.
So what is one myth that we see about LIMS, which we have seen in general, that this is the myth? I don't believe this. What do you think, Niraj?
So I think a lot of like a myth in terms of if you ask me what we, of course that has changed over a period of time, but currently if you ask me, a lot of now people are like gone from calling a LIMS to people are going towards agents. Now people are like, when I talk just recently, one of my customer, he asked me and told me, which agents are you building? So now they are not expecting the LIMS to just do the automation basics that we talk about long back, because earlier LIMS meant that just connecting with the machine, getting the
Right.
Data and presenting the data was a LIMS.
It has changed. It has changed. It is not just a connecting analyzer producing test records. It is not just that. That scope has become much bigger.
Yeah, and because of so much information availability, I think people will push the LIMS company to even go into like a better version of themselves, and that is what we also keep on doing. we keep on investing on getting things better, because the customer expectation is not going to stop.
I think just implementing LIMS, the way I see the myth is maybe it will solve all my challenges. So LIMS will not solve challenges. Usage of LIMS in the right way, putting that culture across all stakeholders, that will solve. Otherwise, if it is not used, it will not solve anything.
Yeah, because I remember that most of the people, when we tell them about the inventory solution, they are very excited. Okay, this is like, I definitely need this, and 95% of them, they don't implement, because it has to be implemented and used, right? You cannot then keep on calling people to get the reagent. You have to order it through the system. So that, I think, I remember that is one of the case. Yeah.
I think you touched base, very good point. What is that one or two features that you think, that is your personal view, every lab should have this thing? You're not asking, but I believe, because I have worked so many years and I have seen, I believe every lab should ask this thing. They should have this thing.
So if you ask me, like bare basics are on the ordering automation and the communication automation. It is very difficult for me to understand people actually doing manual WhatsApp. I have seen labs who have people actually just there to download the report from the LIMS and upload it on a WhatsApp and send it to the patient.
Customer communication.
Both ways. Even if there is a problem, the communication has to be better.
Yes.
The communication is something that must be solved. And it is already solved, actually.
That's also expectation from customers or patient these days, that they want transparency, they want visibility, what is happening right from at the time of booking, who's coming to my home, and is he qualified enough or not, what time he will reach, when my sample has reached to lab, at what time report will come, if there is any delay. Nobody wants to pick a phone and say my report hasn't come, what is happening, and then lab, I will say, because there is some delay. Everybody wants to be informed proactively, and communication is the key out there. I have learned, it's great talking to you. I know we both can speak on this topic hours and hours, and this will not finish, but it is great talking to you, and I enjoyed myself discussing with you here.
Same here, Amit, and it was, I think we can go on and on with different things, but it was really a pleasure to share the platform with you, and I also learned new things, the infrastructure side of it, LIMS as an infrastructure, and thank you so much for having us. Yeah, thanks.
Thank you.